name's Anita Hobson-Powell. I am the Chief Allied Health Officer for the Australian Government within the Department of Health and Aged Care. I'm an exercise physiologist by training. I've then spent 17 years as the CEO for an Allied Health Professional Association. I also had the privilege then of being on the board and then Vice President of Allied Health Professions Australia. And then also I was one of the founders, a board member, and then chair of the National Alliance of Self-Regulating Health Professions. So given that background and understanding of the healthcare system, I understand the importance of allied health and what they can do for an individual, for a community, and for the broader health sector. As the Chief Allied Health Officer, I've been tasked with three main priorities. The first one is to bring awareness to allied health. And so that's making sure that all the decision makers or anyone who's engaging with health services understands who allied health professionals are and their role in the system. The second one is to increase engagement. So working with the sector to improve their engagement collaboratively, but then also their engagement with government and then across other decision makers and regulation bodies to again enhance the recognition and value of allied health professions. And then finally, the strategy is to also increase the inclusion of allied health services. So that is working within the Australian government to look at policies, programs, reforms to see how we can ensure that allied health is not only included, but is included at an appropriate level. So that's working with my internal colleagues across various sections within the department who may be introducing a new program or policy, making sure that they, one, consider allied health, two, making sure that allied health is at the table at the start, three is making sure that how they do engage with allied health is actually providing value, not only to the allied health professional, but also to the consumers who are going to access the services. One of the key projects that I'm overseeing at the moment is to develop Australia's first national allied health workforce strategy. So that's the Commonwealth working with state and territory governments, but also the sector to consider the allied health workforce, the recruitment, retention, and making sure then we have the workforce that is available to deliver health services. And no matter if it's in the health sector, it could be in disability, education, justice, social services, sport, making sure we have the workforce that is available. There is no universal definition for what is an allied health professional. And so what we see is throughout Australia, even at a Commonwealth level, we have different lists of what is defining allied health. You look at the states and territories and there are different lists as well. And what we've seen is allied health is evolving. So we've got new professions coming about, but we also have change in scopes of practice. Now, the 1999 GST legislation only listed 13 allied health professions. Today, Allied Health Professions Australia recognises 25 professions and the state and territories recognise 58 allied health professionals. So it's no wonder that our health and medical fraternity don't understand who's in the allied health tent, what their capabilities, their competencies are, their scopes of practices are. So it's a real critical role that as part of this workforce plan is we are educating not only the health community but also decision makers and the consumers to understand what allied health is. Will we ever get to an agreed definition? I'm not really sure. But at the Commonwealth, our plan is to work with all stakeholders and work towards that, whether that is in 5 or 10 years' time. It will be better if we can have an agreed definition that everyone is understanding, but that list allows for the evolution of the health system. The Australian government recognises the importance of prevention, and that is keeping people as healthy as long as possible to keep them out of the healthcare system or the aged care system. Now, the government have developed a preventative health strategy, 2021 to 2030. Now, this is an all-of-government strategy to improve the health and well-being of all Australians. A part of that strategy, allied health workforce is featured, and the allied health workforce play an important role in prevention. And it's just not in primary prevention, it's secondary and tertiary prevention. So we have a role in stopping people getting chronic conditions in the first place. We have a role of keeping people out of hospital. We have a role of stopping readmissions into hospital. We also have a role in stopping people needing surgery. So prevention is really critical for the allied health workforce and what we can actually do for the healthcare system. We also understand where the need is, and that includes the rural and remote areas. Now, we know how important it is to have the allied health workforce and also the wider health workforce in the rural and remote communities. And the government have invested significantly over the last 5 years around the Allied Health Generalist pathway and also the Allied Health Assistance program to make sure that we, one, retain and also attract the allied health workforce into rural and remote communities. Now, with that funding ending, the government will be looking at this new workforce strategy to make sure funding is siphoned into a strategic way, but also a coordinated way around the country. Allied health is critical to the health system, not only in the healthcare, but also, as mentioned before, in the education, justice, social services, disability, sporting, organisational landscape. So it's really important that we increase the awareness around the value. There's lots of research out there that actually shows the value, but we need to translate that research into some translational practices, some programs where people can actually see the value on the ground. Now, we have from the data over 300,000 allied health professionals in the country. However, this workforce has been underutilised, undervalued, sidelined behind the medical and nursing workforce. So my role is to increase that value. It's to get in front of decision makers, not only within my department, across other departments, but also in other sectors where they are developing programs, they're developing funding models, which will consider ensuring that allied health are included, but also making sure allied health is actually at the decision-making table to make sure that what is being suggested is workable, but also to make sure that there's not any missed opportunities. So it's a big ask, but that's my role, is to actually get out and have all these conversations and trying to make a difference.